I'm joined now to discuss this by Labor's Shadow Health Minister in New South Wales, Ryan Park. Ryan, thank you for your time. You've been trying to get access to the official wait time, so just how long people are waiting for ambulances. But the New South Wales government won't release it. It's like it's a classified state secret. This should be public information. They should be transparent about this.
Well, it should be, and the information that we do get on the public record clearly indicates exactly what you said in your introduction, Sharri, and that is that ambulance wait times are now the worst they are in a decade. And whilst everyone welcomes additional paramedics, the reality is this should have been happening well before COVID and well before that, because the government has failed to invest in this critical frontline service. And as a result, when people call 000, they're often waiting hours for issues that need to be treated very, very quickly. That's not a health system that's working, and that's not fair on patients, and it's not fair on paramedics.
Well, there is some information that is public. So what do you know about how long people in urgent situations are having to wait for an ambulance to take up when every minute that they're waiting could cost them their life?
Well, what we're seeing is more and more people waiting longer than they ever have before, and that includes for those P1 or very critical emergencies. They're waiting longer than what they have previously. When you get out into the southwest and western suburbs, particularly of our neighbourhoods, have expanded. People are waiting up to an hour, sometimes well over that, for emergency cases. Now, that's not a situation that's fair. That's not fair on the call centre staff who take those calls. It's not fair on patients, and it's not fair on those frontline paramedics. And this has been a trend that's been going now for some time. And what we're saying to the government is this needs to be an absolute priority going forward. But the reality is this type of investment that has been announced in the last week should have been happening some time ago.
Absolutely. I mean, it's no point. It's a joke. They're announcing it now just so that they can win an election when they didn't care about the issue 2 years ago. And I know that they didn't care about it because I had the conversation myself about it with the health minister. But Ryan, you know, if this is a problem in the city areas, it must be even worse in regional areas.
Sharri, I've just finished going through the regional and rural health inquiry, something that I pushed for and helped establish, and that landmark inquiry that took over 700 submissions went right across regional and rural New South Wales. One big common thread was that people outside of those large metropolitan cities, Sydney, Newcastle and Wollongong, are facing lengthy delays, sometimes in the area of hours and hours on end. Often the 000 call operator says, get in the car and try and get to a nearest hospital. That's not fair on those people. That's not fair on those paramedics who are often spending hours on the road. And it's also not a system that's working outside our major cities, as well as it's not working inside Sydney and beyond. And that's why this has to be a focus going forward. And whilst we all welcome an announcement of additional paramedics, unfortunately, this has not been a problem that's happened in the last 6 or 12 months. It's been a problem now that's coming on for some years.
Yeah. Look, if you win, if Labor wins the state election next year, if you're the health minister, will you overhaul the way the system operates? We know that nationally, ramping has been a problem. So when ambulances are stuck at hospitals waiting to offload patients.
Well, on week one, Sharri, I want to be doing a couple of things. Firstly, I want to try and work out why only 30% of our paramedic graduates, or up to 30%, don't get employment in paramedicine, become paramedics. That's issue one. I want to have a look at these super stations, because the feedback that I'm getting from the ground is they are not working to respond to incidents nearby, that's not a system that is working as well as it should be. And I also want to have a look at what our emergency departments are saying, because it's one thing, as you know, to get more paramedics. But if they're just waiting at the hospital for hours on end, which is what's happening with ramping or bed block at the moment, then that's not a system that's working either. That means that those women and men are waiting in the truck. They're not back on the road helping other community members. when they call triple zero. And those are the three areas that I certainly want to focus on.
Yeah, okay. And as I say, this is a problem in every state across Australia and has been exacerbated by the pandemic. Ryan Park, thank you for your time.